Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about the study hacks for CPT procedure coding and how to better understand these procedures. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so once again, I am not fancy when it comes to graphics on the screen because none of my videos are edited. So what I am going to offer you though is an interactive experience. If you have the 2023 CPT Professional Edition by the American Medical Association, the AMA, you can follow along with me because that is what I'm going to be looking at today, and I'm going to be calling out the page numbers so you know where I am in the book. So if you have this book, you can follow right along. I'm not going to be talking about evaluation and management though, even though it is in the CPT book. The evaluation and management, I've already done that on a separate video, and I will leave that link in the description box below. So, without further ado, here we go. All right, so we're going to begin the CPT book on page 1044. So I'll give you time to get to that page, but I want to say this first. If you are a student studying medical coding and you are learning the CPT book right now, you do not need to tab the book, period. You do not need to tab it, write it, highlight it, nothing. You don't have to do anything to it. What you have to do is learn how to use it. These books are written by doctors and scholars, so it does not need you to add anything to it. I don't care who says what Facebook group says this, what other place says that. I don't care. If you are taking an AHIMA exam, American Health Information Management Association exam, the CCS, the Gold Standard of Medical Coding Credentials, the CCA or the CCSP, if you're taking any one of those, according to the candidate hand guide, it says that you cannot have homemade tabs. Yes, this book does come with its own set of tabs. Yes, I have done a demonstration video on this. However, I still do not recommend that you tab your books, because if you are using the book and practicing like you are supposed to, you will tear your pages if it has those tabs on it. Okay, and if you don't tab your books and you're practicing like you're supposed to, you will know exactly where to go without having to have all that riffraff, and you will not have to run the risk of tearing your book up, because remember, you cannot have tape in your books at all. Okay, so that's just what I'm going to say there. My channel is about making strong medical coders. That's what my channel is about. My channel is not about these little quickie shortcuts or anything like that. I am trying to tell you all this is how to learn this, so that way it's going to be easier for you in the long run. I'm just saying. So let's begin by looking at this book on page 1044. Now you will see this is the index, because the index is set up differently from ICD-10-CM. The index in ICD-10-CM is set up in the front. In CPT, it is set up in the back. So immediately you're going to go to the back of the book, right? And what we want to do to start learning CPT appropriately and in the right way is to take the time to look at the index. You don't know what you don't know. So if you don't know what procedures are what, or what about this and what about that? If you don't know any of that because you don't have any experience in medical at all, this is the best place for you to begin. Because why? This is going to set a primer for your brain. This is going to say, okay, if we know it starts out with Abe Estlander procedure, and this is a lip reconstruction, we're already setting that foundation. We're already setting that foundation, because when we hear Abe Estlander procedure, we know, hey, that's a lip reconstruction procedure. Boom. And it'll give you the range 40527 or 40761. So we'll get into flipping to the beginning part here in a minute. But that's going to be your two codes that are available for that particular procedure. If you see a little dash in between, that's going to give you the range. Okay, this is saying when we see a little comma that it could be either this procedure code or that procedure code, depending on what is in the documentation. Now if you say, well, Blue, how do I learn to read the documentation? You got to know about the procedures first, right? So that's why I say take the time. Take a Saturday, take an evening when everybody's, watching TV or whatever. You could be in there with your family watching TV, but you could be looking at the book and looking at all the procedures that it has, right? So that way you can start to familiarize yourself with this, and you're still spending time with your family, but you're not wasting all this time. You are fitting in time to study and get this so that you could be so familiar with it, okay? So then the next thing is going to be abdomen and all the procedures that can happen on the abdomen. So you notice right away, if you've been doing this with ICD-10-CM already, where you followed my advice and you looked at the index and looked at all the different options that are there, you'll notice that when it comes to CPT, they will also put like the anatomical location, whereas in ICD-10-CM, we're looking for like the disease and the diagnosis and things like that, because you don't get very far if you're looking up leg, right? So that's the thing that you have to know about CPT. It's going to give you the anatomical location, so that's where you can start. But you need to also familiarize yourself with words like laparoscopy and arthroscopy and all of those things, and know what they mean, because that's going to be the difference between you getting the right code and the wrong code. Because there could be a laparoscopic version of that procedure, or there could be an open version of that procedure. And if you don't know to look at the difference between the two, you won't know where to go. If you know that you have an arthroscopic procedure or a laparoscopic procedure, you know that immediately that's where you can look at in the index. You can immediately go to arthroscopy, you can immediately go to laparoscopy or endoscopy or any of those, rather than starting off with the anatomical location, right? Where in the anatomy they're going, right? Because if you looked up knee, it'll say knee procedure arthroscopy, and then you can go that way, rather than just go to arthroscopy. But this, looking at these words and looking at all of the categories that are here, that's going to help you to know, okay, well, I remember seeing that, because that's what medical coders do. Yes, we do have encoders. Yes, it is so much easier sometimes with encoders. However, there are times where if you don't understand the steps in a procedure, you can get the wrong CPT code through the encoder. And working with the book is a little bit more easier, I think, sometimes, because if you don't know all those steps, it makes it much easier in the CPT book. I'm just saying. So we start off looking there. We see all the procedures that are for the abdomen, and it talks about like artery ligation in the abdomen, biopsy, bypass graft, and a CT scan. So it's got everything having to do with the abdomen. It starts at also see abdominal wall, debridement, infected, and then it goes all the way to x-ray, okay, under the abdomen. So it's got everything in between there, all right? And then we have abdominal, we have abdominoplasty. So that's where you're going to be looking at those types of things, excision, skin and tissue. And then it'll give you the two code options that are available, which is 15830 or 15847. And then they have abdominoplasty unlisted procedure 17999. Now you want to watch it with those unlisted procedures. Now, the unlisted procedures, it's going to be like if there's no other alternative code for that particular procedure, because sometimes there's new procedures that come out, and so then you're having to use that unlisted code. And then other times there is actually a procedure code for that particular procedure. It's just that maybe people don't know how to look it up. And again, it goes back to your ability to be able to do research, and also that you familiarize yourself with the terms and with the types of procedures that are available in this book. Because your brain, even though you may not be paying attention, you may be tired, your brain is going to be recording everything. And it's just like, I know I saw that. Let me look. There's a method to what I do, guys. I'm just saying. So it continues on with ablation, and it lists all the things, all of the locations, and then it indents, and it'll tell you, it'll break down even further. So we have, it goes on to abscess, and then it'll give the locations on abscess. And then you just keep going and you look at all of the locations of where they have incision and drainage for a abscess. So you'll see under incision and drainage that it'll say either see the location, or it'll give you incision and drainage, and it'll list all of the procedures, all of the locations that an incision and drainage could be done at, right? But you can also look at abscess and it'll still be here too. So sometimes you'll find there's multiple ways to find the same code in the CPT index, but you only know that by looking at the book. You know, I'm just saying. So we go through there, we see all of these different procedure codes or procedures that are available here in the A section, and we just keep looking at them. And you don't have to read all of them. Just run your finger down those lists, and you can see everything that's there. And it's going to put that right into your brain, because you're looking and you see, oh, okay, advancement, flap, AFB, and it'll tell you acid fast bacilli. So then you'll say, okay, it says see that. So then you know, okay, AFB, I know if I see a procedure that says, or something in the documentation that says AFB, right? I know I can look here if that's what they did. Oh, okay, that's what they're referring to. And so then I can actually go to that particular thing in the CPT index and then find it in the tabular section. But we're just going to keep looking at that and look at all of those things. Pay attention to the abbreviations, because they will use those throughout the documentation. Now, some abbreviations are not going to be approved. It depends. So you really need to look at, you know, in your facility, if they have a do not use list, then you need to make sure that you reinforce that to your providers, because sometimes they don't know. Providers come from everywhere, and they're taught by many different teachers throughout their careers too. So you want to make sure that every single bit of documentation that comes past your desk is going to be consistent. And if there's somebody that is insisting on using an abbreviation that you know is not right, then you need to go and talk to that provider, or talk to the person that provides the education, so that you can get them to stop doing that. Because there's lots of things that can happen when people see an abbreviation, and then maybe another provider sees it, doesn't know what it means, and then does something to the patient that could potentially harm the patient, or it's a redundant procedure because it's already been done, all because the documentation was not clear. So I'm just saying, so keep looking at those. You'll see those. Alpha fetoprotein, AFP, it says it right there in the index. And then you just keep going, and you see all of the different procedures that are there. And now I'm on page 1050. We see anesthesia, and we see all of the procedures and everything else related to anesthesia. And then we keep going, alkalosis, surgical, and it says also see, or ankylosis, and then it also says see arthrodesis. So that's how we know. Okay, that's what we're doing here. So you're going to follow the index all the way through, looking at everything and all of the procedures that can happen, and paying attention to those abbreviations, so that way we know and we can familiarize ourselves with those things. But you do that when you have some downtime, so that way you can say, this is my study time, this is what I'm looking at, so that I can familiarize myself with these terms. And then when you go all the way to the end, once you've done all of that, and you've looked at all the procedure names and everything else, you'll see on the last flap of the book, it says common abbreviations. Now, you don't have to memorize these. Don't even try to memorize them, folks. But these are common abbreviations. Remember, you can have your CPT book with you when you take the exam, and you can immediately look at these and be like, okay, yeah, that's what they mean by this, and that's what they mean by that. So if you are wanting to get proficient with those, then you can look at these as well. This is all study time, guys. Looking at the book and practicing with the coding, that's all study time, okay? So remember, you don't want to waste time tabbing books, because it takes a while to tab books. And if you're doing that method where you're circling, again, it's wasting time, because, you know, if you can't see an indentation, guys, come on, you know, really? So take the time to look at those. If it takes you a couple days, takes you a few days to look up all the things that on the index part, it's okay. You are making strides to doing the right thing versus, okay, well, I didn't, and I don't know what the procedures are, okay? So when we go back into the tabular section, and that's all of the pages that have the colored, different colors at the edges, and it's all color coded. So it's wonderful. It is really wonderful when you look at it, and you will get so good if you are practicing. You will get so good that you will be able to flip right to the section that you need to go to, all right? And you'll start to recognize those procedure codes. So when we go into the tabular section, of course, it's going to start off with anesthesia, then it goes to like the surgery guidelines. But to get into the procedures part, it starts off with the integumentary system, then it goes into the musculoskeletal system, then it goes into the cardiovascular system, and then it continues on with a digestive system. This is also good for you to do, is take a section at a time, take a chapter at a time. Let's start off with the integumentary system. So the integumentary system begins on page 75. There's a big colored structure of the skin picture on the first part of it. And then it'll give you right there, it begins, right? Surgery, general, and then fine needle aspiration, biopsy. And then it'll explain everything about that here. So what I would recommend that people do if they want to become more proficient with CPT is to take that first chapter of the integumentary system, because that's how we say integumentary. You take that first chapter and you look at all of the procedures, all of the notes, and then like the coding tips. So you can take the time to flip through and then just look for coding tips. So that way you can just read those as you're learning in CPT. That's going to set you up for success, guys. And before you start complaining and going on, if you don't want to do that, then start looking up codes, okay? Get a workbook and start looking up CPT codes. The workbook that I have recommended is going to be that CPC study guide. Even if you are taking an AHEMA exam, you can still use that CPC study guide and use that to help you to practice, okay? So either you're going to read or you're going to practice, one of the two. I personally recommend doing a combination of the two because that's what you're going to have to do. And you can't not like reading, guys. You have to enjoy reading at some point because it is 90% of what we do in a day is read. We do not data enter all day, no matter what anybody tells you. Yes, we are doing data entry, but the majority of what we do is read. Okay, so on page 79, where it talks about the first coding tip, right? It says use the depth and surface area for reporting debridement of wounds. And then it talks about it. It says when performing debridement of a single wound, report depth using the deepest level of tissue removed. In multiple wounds, sum the surface area of those wounds that are at the same depth, but do not combine the sums from different depths. So that's how you're going to start to understand all of these things, guys. You know, it just takes looking at the book. And yes, I have been guilty sometimes of missing a note here or there in the beginning when I very first started. But after a while, you learn to do that, okay? But we're all human, so it takes time to refresh your brain too, even if you are a veteran coder, okay? So it talks about the biopsy on the next page. It gives you more illustrations on page 83. And it gives you like all of the things. And each code is broken down into the parent code, and then of course it has a child code underneath it. So all of those things are in conjunction, okay? Everything that is there, all right? So it starts off with, if we look at code 11400, excision of benign lesion, including margins except skin tag, unless listed elsewhere, trunk, arms, or legs. And then it gives you like the semicolon, right? It says excise diameter is 0.5 centimeters or less. But if let's just say that we needed a bigger code that has more, right? A bigger excision. That next code 11401 is excise diameter of 0.6 to 1 centimeter. And that is for a benign lesion, except skin tag from the trunk, the arms, or legs, okay? So as it gets higher and higher, it's getting more and more. So if we see that indention, we know that if, let's just say that the excised diameter was 3.2. So we'll see at 11,404, excised diameter is 3.1 to 4.0. So 3.2 is between those two numbers. So that would be the one code that we would select if that was what we were looking for. So, and then it goes on and it continues. And you'll see that where, okay, then it stops at 11,406. And then it says, and then at 11,406, it says for unusual, because it says right there, excised diameter is over 4 centimeters, right? And this is for unusual or complicated excision, add a modifier 22. Well, how do we know what modifier 22 means? If you look at the first inside cover of the book, you'll see all the modifiers right there. And modifier 22 is for increased procedural services. Now, you have to be very careful about this. Not everything is going to be an increased procedural service. That's going to be in those situations where it's above and beyond what is the normal approach or what is normally done for that procedure in order to accomplish that procedure. And the provider has to document that. It can't be that I just spent additional time excising this wound. Okay, that's not going to be sufficient enough to add a modifier 22. It needs to have some kind of detail, like how long. It took me 2 hours to do this, or it took me 120 minutes to do this excision due to excessive, whatever, anatomy, or unusual anatomical body parts, or however they want to say it. But there needs to be more detail in that. I'm thinking off the top of my head. So that's just what I'm saying. It needs to have some detail. It cannot be just plain and simple, it just took me extra time. That's unacceptable. And an insurance is not going to consider that. An insurance will consider if there is something that was above and beyond and unusual about that, why it took additional time or what was the deal or whatever. They're going to know based on the documentation. So that's where you have to talk to the providers about that. If it was unusual, then that's when you're going to have to document it was unusual due to XYZ, So, but in the back, if you wanted more information about modifier 22, you would look in Appendix A, and that is literally the first one there. It says increased procedural services. So Appendix A. So your appendixes are going to help you, and I'm talking faster because I'm about to run out of time, but increased procedural services, modifier 22, when the work required to perform a service is substantially greater than typically required, it may be identified by adding modifier 22 to the usual procedure code. Documentation must support the substantial additional work and the reason for the additional work, increased intensity, time, technical difficulty of the procedure, the severity of the patient's condition, physical and mental effort required. Note, this modifier should not be appended to an E&M service, okay? So it's telling you in the appendix more about the modifiers, okay? So again, you're going to learn that by going through the book. And take a few chapters a week, so that way you can do this based on, your study schedule and how when you are going to want to take your test. You can do it that way by looking at all of these notes and looking at all of these procedures. And again, this is going to give you that wonderful primer so that way you understand the book. All right, so take a few chapters a week so that way you can be done in a few weeks reviewing. Some sections are going to be bigger than others. The orthopedic section is quite large, and so is the medicine section. So you may have to take a couple of days at that one, okay? Same thing for the pathology section as well. You're not going to have to understand everything right away, but you do need to put it in your brain so that way it's not going to be so overwhelming for you. Now, the best thing about studying for CPT is, okay, well, how do I know what these procedures include? So there's a lot of references out there that can help you to understand. There are 2 books that I do recommend. The one from Optum, of course, the Coder's Desk Reference for Procedures. It is on sale right now if you go to optumcoding.com. Now, the other one is that I recommend is at codingbooks.com, and it's Decision Health. So Decision Health makes wonderful reference books for medical coders. They are quite a bit more expensive than the Optum books, but I really like them. Now, this is not an ad for them, but you guys know that I suggest things that are supportive and helpful to medical coders because I understand how difficult it is. I went to a conference, and this was a gift, which is why I know that this book is fantastic. It is the Procedures Plain English Descriptions book. So you can get the latest and greatest, the 2023. It's a couple $100, I think. It's like 180 something last time I looked, or 190 something. It may be, I don't know. I haven't looked because I got to stay away from those websites because otherwise I will be buying books. But you can find that at codingbooks.com, the Procedures in Plain English Descriptions, okay? So what it is when you get it, it has all of the CPT procedures in it as far as like the procedures and stuff. And then it will give you the layman's explanation of the procedures. So everything that is included in that procedure. So if you're wondering what is included, if we looked up metatarsectomy, right, which is CPT code 28140, it's explaining in this book what is included and what it is. So it'll tell you what it is if you are really not sure. And then you can look at the procedure note and you can look at the description of the procedure and see if they kind of match up. Okay, then I know I'm on the right track, and this is exactly what the provider did. So if you look at metatarsectomy, right, it says 28140, the entire metatarsal bone is excised. A dorsal incision is made in the skin over the affected metatarsal and extended over the metatarsal pharyngeal joint. Soft tissues are dissected, taking care to protect the digital neurovascular bundle. The metatarsal bone is severed from all of the attachments and excised. If the procedure is performed for an injury or infection, all damaged or septic tissue is debrided. Soft tissues and skin are closed in layers over a drain, and the dressing is applied. So that's on metatarsectomy. So that's letting you know what all is included in this particular procedure. And so you'll see this. This whole thing is like a dictionary of the procedures. Essentially, is what it is. So that's what that's how big it is. Again, I'm not going to show you all the cover because then I get those complaints of it's backwards. But it covers everything in here. And so it is very helpful, especially for new medical coders and veteran medical coders, to understand what all is included in these procedures. So with that said, please review the CPT manual. Look at those. Look at the index first. Take the time to get comfortable with that index. So that way you know what's available in that CPT book. Then go through each chapter and look at all of the coding tips throughout. And then if you are still wanting to learn more and get more comfortable, then get a book like the Procedures Plain English Descriptions from it's Decision Health at codingbooks.com, or the Coder Desk Reference for Procedures from Optum, okay? So, and I will be leaving both of those links in the description box below. So if this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye!